Hey everybody, it's Dr. Mark Tachinowski here today to tell you a little bit about tennis elbow. So tennis elbow is more commonly known or less commonly known as lateral epicondylosis. It's essentially pain over the lateral epicondyle in your elbow. And lateral epicondylosis doesn't really mean much to me. It doesn't mean much to the doctors in this office, because just because it's called lateral epicondylosis doesn't mean it tells me how it got there. It tells me where the symptoms are, but it doesn't tell me how to reverse it. So what we would do with a typical lateral epicondylosis patient is we would test the shoulder girdle muscles, we would test the tricep, the bicep, all of the muscles that attach to the elbow, and we would hunt for weaknesses. So what we typically find is that when somebody has a tennis elbow, they might have, let's say, weakness in their middle deltoid. And that's evident because every time they do this, they will want to do this with their hand. And they have a very hard time just abducting their arm without using their hand. That's a muscle relationship that we can pretty much identify and we can reverse. Also, with external rotation of the shoulder, in this position, a lot of times patients can't do this without doing this. So if you notice that you have to extend your hand in a certain way in order to feel stronger somewhere else, you have an accidental relationship that is making you feel stronger, but it's doing harm. The last one is going to be pronator, that we see often. So a pronation is turning that palm down towards the ground. And if every time you turn your palm towards the ground, you have to extend your hand a little bit in order to get extra strength, then there's a good possibility that your pronator is weak and your wrist extensors are trying to help. So those are the things that we look for with tennis elbow. If we only treat it over here, we would never be successful. We would never be successful long term. Maybe in the short term, patients would say, I feel fantastic, but after they left here and they started doing whatever their triggering activity was again, guaranteed those symptoms are coming back. So we have to go down, up, and all around and look for what is the actual cause. That's your tennis elbow talk.